We are back with my new best friend, cardiologist, Dr. Eli Friedman from Memorial Healthcare Systems. Thanks again for being here.
It's an honor.
I'm learning a lot about what to do, what not to do, and how to stay more heart healthy. Tell me more about what to stay away from, because that for me is a really big deal, because I love to know parameters. And so if you tell me, Michelle, you can eat a fatty type of a meat, a red meat, once a week, I can stick to that.
Yeah.
You were talking earlier
about
the one, the one, my favorite ingredient.
Yeah, eggs. So certainly this is not advice for people with young kids. We think eggs are probably good for kids, but sticking to folks who have reached their adulthood, may have heart disease, eggs are not so good. And with all of our focus lately on cholesterol and people's aversion to wanting to take cholesterol medications, if you wanted to do egg whites, maybe that's a better alternative, but we do know that eggs are affecting cholesterol.
So for someone like me, how many eggs can I eat a week? Is there such a thing?
I would say try to incorporate it no more than 2 to 3 times per week.
I ate one on the way here.
Okay, cool. There you go. 2 more times.
All right. So just so you all know, I put the kale in to the soup, and in just 20 minutes, I am going to pull the bay leaves out, and then we're going to puree only about 1/4 to 1/3 of the soup to give it a better viscosity and a little thickness to it. Naturally, using the beans. That's what beans to me are so great for also, is giving a creamy texture without cream. But next I'm actually going to put the doctor to the test. He's going to make a lovely salad that I created just for this show. I heard that cherries were good for the heart. Have you ever heard that before?
So this probably falls into the antioxidant category, and this is sort of that debatable category right now. We don't know 100% sure whether or not these antioxidants help. They definitely don't hurt.
They don't hurt. But I heard that this color, things that are this deep red color,
antioxidants, pomegranate juice.
Right.
Antioxidants won't hurt you. That's for sure.
So add a little bit of quinoa. I'll tell you when to stop. Do you like quinoa? Do you eat a lot of quinoa?
Love quinoa. It's wonderful. My wife cooks with it all the time. I'm asking for it all the time, too.
Oh, great.
It's great.
That's good.
Okay.
Thank you. Go ahead and add, these are green beans that we slice nice and thin, and these are green beans that have been quickly blanched in some water. You can add them all or half, or totally up to you.
We'll probably go with half.
Okay.
Great.
Here you have some shallots.
Great.
Just some simple, tiny dice of shallot. Go ahead and add as much as you'd like.
Can't have enough of those. I'll put the whole thing in. Yeah, I love it.
Wow. You like onions.
Love onions.
Good.
Yes.
Good.
Great flavor.
Okay, so you have another kind of an onion right there. That's a scallion, sliced really nice and thin. That
Same thing. It's all going in.
Wow, I love it. Then I have some feta cheese.
Yes, a little salty, so be careful with it, but I like it very much. Great flavor.
Go ahead and add a little bit of feta, as much as you like.
Probably do about 1/4, I would say, of this.
Mix a little bit, and then you're going to add some things to make this taste delicious.
Great.
I decided, because there's cherries around, I love either a cherry or a fig with feta. I think that sweetness,
it's a great taste.
Contrast with the saltiness of the feta is just delicious. Go ahead and mix that up a little bit. And now we're going to kind of make a little vinaigrette inside of the salad. So you've got your extra virgin oil right over there. So what would you add? Let's see how much you would add to this. Because I go heavy. Oh, you go heavy too?
Yeah.
I like it. Tell me when to stop. This is red wine vinegar. I'm going to add lemon too, so I'm not adding too much.
I'm a big red wine vinegar fan, so the whole thing,
Great. And I'm just going to do maybe 2 of these. Are you good with that?
Love it, yeah.
Most people talk about the Mediterranean diet, right?
Yeah.
Is that what you still recommend?
Yeah. This is a wonderful example of that. All these wonderful foods you've chosen for this is a fantastic example of the Mediterranean diet. I think it's really about being realistic with your expectations. Food is a source of comfort, so working within the foods that are comfortable to you and maybe taking some suggestions from here today and changing those things up and slowly getting that diet in check is great.
What about fish? I'm making codfish. Is that a good fish?
It's great. Whitefish is fantastic. Salmon is fantastic.
Oily fish are good,
fish
right?
are really, really good. So fish is great. Chicken is great. Baked chicken. Try to stay away from fried as much as you can.
Okay. Yeah. I love fried chicken. I'm throwing mint and basil in.
Yes.
So how often should we see a doctor?
I think everybody should, at least once they hit adulthood, 18, 21, see a physician once a year. The new blood pressure guidelines have come out, so 50% of the people in this room, 50% of the people in the country now have high blood pressure based on those guidelines.
50%?
50%.
That's enormous.
It doesn't mean you should be on treatment, but it definitely means you should have a discussion. And to me, it's always better to have the discussion before things happen as opposed to having it after.
All right, so I'm going to go ahead and what I like to do is, and you can taste this when I'm done, but I like to actually serve it and then put a little bit of that big, beautiful sea salt, but just the tiniest touch right on top. But this is so pretty with all the herbs and the cherries and the feta cheese. So this is right up your alley?
Perfect. I want to make this tonight.
Yeah. So do you cheat?
Yes, absolutely. I have to. Sundays are my cheat day. Yeah.
Really?
Absolutely. You have to. It keeps you sane. Yeah.
Good to know.
Yeah.
Well, tell me if you like that, and then sadly, I'm going to send you back off to go work at Memorial and help save
this with
people
me?
like
It's
you.
delicious.
Absolutely can.
Great.
Thank you for being here.
Thank you very much.
Thank you so much.
Oh, it's a pleasure.
And keep saving people like all of us. Please. Don't move. We've got lots more to show you. Thanks a lot.
Thank you.